Hello, hello. How are you guys doing? Minister Jen Jen coming to you. Jennifer. I do apologize. I'm extremely late tonight. I had a family emergency with my mom, but everything's fine. She's fine. But I think I shared on Sunday how she had cataract surgery yesterday. But I have to surely I have to leave. Hi, Sister C. Right. Hi. I have to leave because she moved the drops while my brother was making her something to eat. So now I have to go look for the drops. If not, then um, I have to go early in the morning to go get them from her eye doctor. But here or there, it's been something. And then my little one is under the weather as well. So we were in the ER late last night. And so I've been trying to nurse her back to health. And so, Mr. Ginger, just again, pray for me. Lord, give me strength. He has been giving me strength. Lord, He has being a caregiver to to your um to your loved ones that has dementia. It takes a toll sometimes. You really have to have patience. I have it though. I have it for my mom because I know if I was in this situation, something was going on with me, my kids, or anyone for that matter, I know my mom would be there. Um, so, and she's always thanking me. I'm like, Mommy, why are you thanking me? And she's like, cause if it wasn't for you, I'm like, no, I know you would do it for me. So I just understand now because she also with my grandma, her mom had Alzheimer's as well, and my grandmother, out of the five kids, always looked for my mom, relied on my mom, and so um, not saying her other siblings, didn't care or anything like that, but it was just my mom was the more nurturer one. I don't know. She has with her spirit. My mom has the spirit, like a nurturing spirit, as you can say. I could say. But yeah. So after this, I have to go look for those drops because she needs drops in her eye. So we can have a speedy recovery. But God has been showing out, and I won't let the enemy get in the way because it had some I had to cross some hurdles yesterday, but she got it done. I was telling Bishop, I was texting Bishop earlier. I'm like, I was crying yesterday because it was like finally she got it done. And Halima was like, Mommy, when Nana get that surgery, she's gonna be walking everywhere now. Like she's gonna be moving around more and everything because her eyesight is, gonna be better or whatnot. So I cried for tears of joy because my job wouldn't let me but able to like really like take off or not to take her to get this done. But I'm not saying that she wasn't going to get it done, but I was just happy that she got it done because last year, remember, she fell outside and she fractured her hip. So I just thank God for giving me the strength and allowing me to be able to take her or whatnot and giving me the patience as well. And I had Blessing wasn't feeling well yesterday, so it was a lot going on. I was like, no, my mom gonna have this surgery. So um now we're just on the way to recovery now. But she's fine and well, and I thank you guys for all your prayers. And so let me go on by saying, how you doing? So I wanted to come to you tonight. I know on Sunday I said I was going to present prostate and testicular awareness, but I may have overstepped. I know actually didn't it does not fall in the month of December. I do apologize. So tonight I will be bringing forth to you about I will be bringing forth to you um something else that is as you see on the screen, which is called excuse me, which it falls in the month of December. It's called a plastic anemia awareness day, or we awareness. We bring awareness for this disease. Aplastic anemia awareness, which is it is a rare bone marrow disorder where the body stops producing enough blood cells, leading to severe fatigue, infections, and bleeding. It's crucial for early diagnosis, supporting patients, and promoting blood slash marrow donations through different organizations like the Aplastic Anemia and the MDS Foundation, which is abbreviated AAMDSIF. And this is providing support. They provide support and information if no one knows about this disorder, which is aplastic anemia. It's a rare condition, like I said, where a bone marrow does not produce enough new blood cells, red, white, and platelets. If I'm pronouncing wrong, sorry. Sorry. And it causes extreme fatigue, like I said, and infections, easy bruising, and shortness of breath. Those are the symptoms. And it can affect anyone, as I read. It can affect anyone at any age, with about 600 to 900 new cases in the U.S. annually. That's also. So this month is dedicated to people that are going through this, um, the, and is dedicated to highlight this disease. Hi, Sister Tanya. And it's dedicated for highlight with this disease, the symptoms, and the need for understanding and support. It coincides with this month. They put this in this month, the holiday, because of the holidays. A time with patients need extra care and extra support from their community, from their family, from their friends, the people that are going with this through this. And it was saying, like, how can we show support? Like, how can we show awareness to let people know about this disease? Because I know you guys, did you guys know about aplastic anemia? I did not. I always hear about leukemia or bone marrow, or you need a bone marrow transplant or whatnot. But I never heard of aplastic anemia. Is so how we can support, we can help patients and their caregivers and families facing this condition. We can do that. You can donate blood and blood marrow in the marrow, donating are vital for so we can treat people with this disease and support the organizations as I presented early just a while ago, those different organizations, which are the AAMDSIF, or volunteer in different, or even groups, volunteering groups. And I know I always come to you guys. With the ribbon. And right. And everyone, you have anemia, Sister Tanya. So everybody always says, because Minister Ginger is always cold, like always cold. But when I tried years ago, when I tried to donate blood it was the old church that I used to attend, they were having like a blood donation for Children's Hospital locally here in DC. They had like a mobile clinic that came, like a big old RV. And so I was ready to, some messages, I gotta tell you a story each time. But I was ready to give blood to help kids that needed blood or whatnot. And then too, my blood, it can go to A or B, because I forgot what it's called, but I could donate. But they told me I couldn't donate because I was borderline anemic. And I'm like, I never heard of that. But I'm not anemic. It's weird. Like, I'm like, you sure? And so I used to get teased by my old coworkers, like, you need to go get your blood work checked, or go to a different doctor because you're showing signs that you're anemic. But I'm not. It's weird. I'm not though, um, but being as though it was given a children's hospital or a children's blood bank, I couldn't give blood because they said I was borderline anemic. When they pricked my finger, the numbers were I guess too low or not. So I was a little disappointed, but yeah. And so the ribbon, back onto um, aplastic anemia awareness. So the ribbon, you guys, for them are a red and white ribbon, a red and white ribbon. Yes, a red and white ribbon. You know, I always gotta come to you with my ribbons. And look, tonight I got my red on, but tonight I got my I Love DC shirt. But I had my red lipstick. You know, I always wear my red lipstick. Um, is a plastic anemia, is it a disability? Yes, it is. It can be. Yes, because again, it could leave people um because it attacks I guess the immune system, as I read. Um and also um I read that I already told you it's a rare blood disease, but it says where the bone marrow fails to produce enough blood cells, as I told you before. But they said about only 2 out of 6 people are affected by it per million. Two to 6 people per million annually in the U.S. and in Europe, but with fewer than 1,000 in the U.S. are diagnosed yearly. So it's not a lot like a high number, but I did I did want to bring forth to you tonight on that. I do apologize again that I did not bring forth. I gave wrong information on Sunday, but I wanted to bring awareness to this disease, aplastic anemia, and also I've read, this is interesting also, um and it said that can COVID cause this disease? And they said in several cases aplastic anemia has been reported following an infection from COVID-19. Importantly, they said there was findings a 16-year-old girl with a severe aplastic anemia with no history of this disease following an Omicron infection, which did not respond well treatment despite supportive treatment and immune suppression. So you don't know. You don't know if you have it or not. But I did disclose the symptoms, and it said, "What are the red flags? Signs and symptoms of low blood cell counts." It helps to carry it. And then it said, if you do have it, if patients do have it, this is what they have to do. They usually have to carry oxygen for their body. A low red blood cell count also can cause shortness of breath, dizziness, especially when standing up, and headaches, coldness in your hands or feet, pale skin, and chest pain. That's a little scary. So, again, make an appointment for your primary doctor and get your blood work done to find out if you're anemic or whatnot, or get checked on about aplastic anemia. It's a little I'm not saying that you have it if you're cold all the time. I'm not thinking I have it as well, but it's always best to always get a physical each year and get blood work, get a blood panel or whatnot. So I know next month I'm due for everything, so I'm going to be making my appointments. But I can't tell y'all to do XYZ and I don't practice what I preach. So I'm going to be making my appointments for next month for everything. And And I know I have the dentist appointments coming up too for me and the girls. So I just wanted to bring forth to you tonight about aplastic anemia. I hope I was very informative for you guys. And again, if you feel like you have some of these symptoms, go to your make an appointment with your primary doctor, or your GYN, or even if it's that severe, go to the ER or whatnot. And again, I'm not a healthcare provider or whatnot, but I have a passion for it, and so don't ignore your body, because your body can tell you, or your body. Let me say that your body if something ain't right, and if it don't feel right, go to your doctor, go to the ER or whatnot. And if you don't have a doctor, try to find one, or talk to a loved one or a friend or whatnot. Like, who's your doctor? Like, who do you feel comfortable with? Because some people are scared of going to the doctor or having a mammogram, like I said, like, or going to the doctor, period, or going to the dentist. Like, network about that. Like, usually I always like shop around, like how you call your girlfriends for, or someone like, hey, who did your hair? Like, how you recommend someone like that, you can recommend a doctor like that. I know some doctors still have, some, I know we have some young doctors here now. Oh, really? Yes. And you loved it, right? For 25 years. Praise God. Yes. And so it's like, same as you ask somebody where you get your hair cut, where you get your hair done, or where you get your nails done. Same you could do with your healthcare provider or your dentist as well. Because your body is your temple. You want to be on earth as long as you can live. You got to take care of your bodies, you guys. And so I wanted to come forth to you tonight about plastic anemia and bring awareness and show support with it as well. And wear your red and white. Wear your red and white to show your support and your awareness on this disease. And I want to say good night. And again, I do apologize for coming on here late. I had my little, I have family emergency, which I have to go jet out and do now. But I love y'all. I'll see y'all on Sunday, and enjoy the rest of y'all week. Minister Jen Jen, see ya.